Hey guys, Lucas here. In today's video, I'll be discussing the intriguing correlations, both negative and positive, between caffeinated beverages and heart health. I'll be going over a multitude of studies in this one, so for those analytically driven learners out there, you're sure to enjoy this. That being said, let's get right into it. So, what is caffeine? Caffeine is a stimulant which is naturally occurring. You can find it in a ton of popular beverages, such as coffee, tea, or energy drinks. Typical effects after the consumption of caffeine include boost in energy, stimulation of your gastrointestinal tract, physical performance advancements, and elevated heart rate/blood pressure, just to name a few. As I mentioned previously, the effects of caffeine on the human body are both exciting and scary. I mean, as an avid coffee and energy drink enjoyer, I've certainly experienced both sides of the spectrum. I can recall long nights filled with fruitful studying thanks to the consumption of my favorite caffeinated beverage. However, I also remember terrifying experiences in which it felt like my heart was doing backflips and I was consumed by the immense feeling of anxiety after an additional shot of espresso. Those stark contrasts of the widely accepted substance are what inspired me to dive into how caffeine affects our heart health. In 2016, a cohort of Brazilian researchers had a question: what are the short-term effects of high-dose caffeine on cardiac arrhythmias in patients with heart failure? The researchers designed a randomized clinical trial using data from 51 subjects with heart failure. The subjects consumed a total of 500 milligrams of caffeine over a 5-hour time span. For those unaware of proper milligram dosing for the average human, a cup of coffee has around 100 milligrams. Along the 5-hour time span, the researchers closely monitored how the rhythms of the patient's hearts fluctuated throughout the process. If you take a look at the highlighted section from the table on the right, you'll notice that while exercising, there is little to no difference between the caffeine and placebo groups in peak heart rate beats per minute. You'll also notice how the peak systolic blood pressure readings were similar as well. In fact, the researchers essentially found no differences between the control and experimental groups. Despite what I imagined to be a seemingly obvious answer, it turns out that even the high-risk group saw no significant increase in irregular heart rhythms. It's fair to say that in the short term at least, a large dosage of caffeine is not expected to trigger dangerous rhythms to our precious heart. In the introductory portion of today's video, I briefly mentioned the compounds in which caffeine could be consumed. This begs the question: what are the differences, if any, between the fashions in which you consume caffeine? The Travis Air Force Center in Fairfield, California, hosts some of the brightest emerging minds in America's medical field. A group of these talented researchers came together and created a randomized controlled trial of high-volume energy drinks versus caffeine consumption on ECG and hemodynamic parameters. 18 participants were given a total of 320 milligrams of caffeine, either from a naturally occurring substance like coffee and tea, or an energy drink. Blood pressure and heart rhythms were measured throughout. Now take a look at the sections highlighted in pink on the graph. The peripheral systolic blood pressure in the energy drink group, outlined in red, are significantly higher at the 6-hour mark as compared to their naturally occurring caffeine group counterparts. As expected, both groups saw an initial spike in their heart rate and blood pressure. However, both 2 and 6 hours post initial consumption, those who consumed the energy drink saw a sustained high blood pressure and a higher disturbance in their heart rate. Interesting, right? The researchers point to additives as the leading cause for these major differences. Energy drinks contain elements such as sugar and taurine, which could have led to the abnormal figures presented in the graph. It seems that the means through which you consume the caffeine are massively important in determining the effects on your heart. In 2014, two researchers from the physiology department of Ain Shams University in Cairo, Egypt, took a look at the long-term effects of caffeine in the cardiovascular system of adult rats. They designed a study in which 20 adult rats at the equivalent of human adult age, that being 18 to 20 months, were given 25 milligrams of caffeine a day for a 6-week period. The results were mixed with this study, showing both helpful and harmful effects of caffeine on the rats. 2, 4, and 6 weeks after treatment, vivo heart rate, mean arterial blood pressure, and systolic blood pressure saw considerable increases in contrast to the control group. Additionally, the diastolic blood pressure saw increases at the 4-week mark in the caffeine-intaking rats. On the positive side, the results showed antioxidant effects on the caffeinated rat group. In the lower right quadrant of the bottom table, the plasma nitrate level increased by over 100 moles per liter. Humans' adrenergic receptors are stimulated by caffeine, so raised blood pressure and heart stress are caused by the fight or flight response of prolonged use. On the other hand, your cyclic AMP is increased by caffeine consumption. Your heart cells are able to handle more calcium, which leads to faster and stronger heartbeats. The result of this is nitric oxide release, which helps with vascular function. So, is caffeine the savior or saboteur to your heart? To my caffeinated beverage lovers out there, the research is actually in your favor for most instances. If you're drinking a few cups of coffee a day, you're probably fine, maybe even benefiting from it. But if you're drowning multiple energy drinks or relying on caffeine constantly, the risks start to outweigh the benefits, especially over time. The bottom line is, moderation is key. And when it comes to caffeine, not all sources are created equally.